Hello, everybody. You've tuned in to the Indiana State Police Roadshow, brought to you by the Indiana State Police Alliance and Cops for Kids, a subsidiary of the Indiana State Police Alliance. Thank you for tuning into our show each and every week. Thank you to Tom Triol, our man behind the scene, putting us on YouTube each and every week. Wave hi, Tom. Good to see Tom here today, and for putting us on the YouTube site. Make sure that you go to the Indiana State Police YouTube channel and look at all the videos that Tom puts on there every week. We always have new stuff, and Tom's even got some old stuff from the files way back when they're on the YouTube site. So make sure that you visit them and see what Tom has to offer there. Mr. Jeremy Funk's my guest today. Jeremy, thank you for being here today.
Yeah, it's a pleasure coming on. Thanks for having me.
I appreciate you being here with the Indiana State Department of Health. And your title is?
I am the epidemiologist for the Trauma and Injury Division.
Oh, what exactly does that entail? What do you do there?
So that's a pretty wide-spanning term, I guess, epidemiologist. But I essentially monitor trends that are happening health-wise on a population level rather than an individual level.
Okay.
So I look to find ways that we can make interventions to improve the health of Hoosiers.
Good. Now, how long have you been with the Department of Health?
About 8 months now. Yep.
Okay, good. Well, good to have you here, and I appreciate you coming in.
Yeah.
Something that caught my eye, I listened to you guys' webinar. A lot of times when those are coming through, a lot of interesting subjects that come across there, and I caught yours, and we talked about this, because this is something that's unfortunately taken hold of many counties across Indiana and across the nation. As this drug overdose thing, and Senate Enrolled Act 139 created new requirements for the coroners in cases of fatal drug overdoses. Mm-hmm. Can you tell us what that is?
Yeah, so in November of 2017, we kind of launched a pilot at ISDH to provide enhanced toxicology panels to coroners. And what that works to do is provide a standardized approach to collecting what caused the overdose. So prior to that, a lot of coroners would just be testing what they found important. And so for data purposes, that's not always the best to monitor and produce interventions. So what we're doing is providing a means for coroners to use these panels, because they are relatively expensive. But we're able to now work towards standardization of data.
So why do you think it's important to involve the coroners in this data?
Yeah, well, coroners are the ones on the front lines collecting that data. So coroners will collect blood and urine and vitreous of suspected drug overdose cases. And what they work to do is establish a medico-legal cause of death.
Okay.
And so coroners themselves are relatively underfunded as an entity. So what we're doing is providing them a way to establish the medico-legal cause of death,
okay,
and provide us better data, because in order to do better interventions, we need more accurate and timely data.
Well, and you talked about that the coroner's offices are underfunded, which I'm sure they are throughout the state. So is there a program or something where this program, or is there a means where this program is going to be funded? So
July 1st, the State Department of Health is covering for the enrollment of coroners into the Enhanced Toxicology Pilot Program. So we, for a full fiscal year until 2019, will be paying for all of the enhanced toxicology. Then after, the state will be providing those funds to those coroners.
Okay, good. So this will be happening through all 92 counties. This is going to be a requirement.
Yes, so it is a requirement for them to be running these standard tox panels. However, we do provide a little bit of flexibility to those coroners. We have established a contract with EMMIS laboratories, and 79 of our coroners are currently using them. However, a few prefer to use Access, which is another competing laboratory. We've allowed them to maintain that relationship and use the same tox panel. However, we just ask that they share that information with us.
Okay. So how do you see this data addressing the overdose problem? What are you going to do with that?
Yeah, so there's the standardization that I had mentioned prior, but really what it comes down to is it provides us timely geographic specific data for opioid-related, to combat the opioid epidemic. So we hope that by maintaining a more specific database, that we'll be able to use that information to intervene in certain locations that aren't the same. So for us to build an intervention specific to Indianapolis may not be the same drug-wise
Right.
for what's happening out in a smaller community. So by providing local stakeholders with information, police department, first responders, with information regarding the drugs that are causing deaths in those communities, we're able to better respond and prevent death. And that's the overall goal of those.
So you may not be seeing the same drug come across Gary, Indiana, as you are in Evansville, Indiana.
Exactly. So by maintaining, I guess, a standardized approach, we can differentiate between the different types of drugs taken, the different brands even, so we can identify maybe this specific drug is a prescription, and so maybe we need to look at the prescribing patterns, or maybe there's a difference between heroin and fentanyl, for example.
Mm-hmm.
So, we're able to now use this data to differentiate between communities that might have a heroin issue versus a prescription drug overdose issue.
So I didn't talk about this at the beginning, but has this already been established? Has this law taken effect and it's enacted now?
Yes, sir. So as of July 1st in 2018,
Okay.
it was enacted. It goes into budget in the next fiscal year, though. So as I said, we're using our CDC funds to pay for all the coroners to run those panels.
So what kind of cases will the coroners be looking at? Is this going to be just drug overdoses, or is there going to be other types of cases also?
Yeah, so it's accidental or unintentional suspected drug overdoses. So whenever a coroner has a suspicion that, hey, this might be a drug-related death, they are provided with the funds from ISDH to run that panel. So I think where that comes into play is the manner of death.
Okay.
So if it's suspected as unintentional or accidental, we will fund that.
Okay.
Yeah.
So you mentioned before the National Medical Services was chosen as a vendor.
Mm-hmm.
How did they get that? Where did that come from?
Yeah, so we sent out kind of a request for people to put in bids, and they were the one that provided us a web-based portal that both coroners and we can access. So we were both efficient with our money and increased timeliness from about an 11-month wait period to a 6-week wait period. So now we can produce very timely, accurate data for communities in response to drug overdoses.
So I'm sure it probably happens around the state. What if a coroner says, no thanks, don't want to participate?
Yeah, and they're right. So we ask that if they would like to use their prior user, that they give us access to it. So the law mandates that they share the toxicology paneling with us.
Okay.
And that they run the enhanced toxicology panel. So until it's funded and they're able to choose between the two, and but however, there's been a few that have kind of lagged behind and just asked not to comment, or that they would like to not participate. So we're working with them to identify maybe a common ground. But yeah, it's a mandate that they share that information and run those panels.
Great. Well, again, you're listening to the Indiana State Police Roadshow, brought to you by the Indiana State Police Alliance and Cops for Kids, a subsidiary of the Indiana State Police Alliance. And I'm speaking with Jeremy Funk from the Indiana State Department of Health. We're talking about a new mandate took place July 1, 2018, talking about coroner and testing of drug overdose, accidental drug overdose, and a new program that they've got going. So the status of the program right now, do you have anything at all that kind of tells you where it's going, how it's looking?
Yeah, so we're starting to get cases to roll in. As I had mentioned, it takes a few weeks, takes about a month for us to get access to the finalized toxicology reports. So we're starting to have hundreds of cases come in for us to analyze from coroners that have run them. We have, like I said, 79 coroners currently submitting, and a few that are maintaining their prior relationships.
So what's going to be the overall goal of all this?
So as I mentioned, just incredibly geographic specific data in which we can provide entities like yourself the necessary resources to combat this massive issue. So in 2017 alone, we had 1,711 overdoses, which was up 15% from 2016. So we're doing the best that we can to provide those on the front lines with all the materials they need. And in order to do that, we have to have more accurate, timely resources. So
now, will this information be available to the public online, or how will that be available?
It will be. So we produce reports, monthly reports that's on our website at ISDH. So you are able to access those monthly reports there. Also, we provide the CDC with information, so you can also find Indiana's information from the CDC. And also, we're using this information to inform Governor Holcomb's office.
Good. So you were talking about the state funding of the toxicology program. Exactly how does that work? Where's that going to come in?
Yeah, so we are currently working as the funding agency for that third-party testing.
Okay.
So coroners are submitting toxicology reports, and the EMMIS will be sending us that bill.
The overdose that you see now that you've talked about, is there something that you're looking at as far as information that you're thinking this is going to be more of a problem area, or this drug is going to be more of a problem area? Is that what you're finding kind of early on, or do you even know yet?
It's a bit early to tell.
Okay.
So we only have 13 counties in an original pilot, so we have established a little bit of a baseline for those counties. So I could maybe specifically enlighten you on those. However, as you know, we get more and more information. The hope is to work that into more of a rapid response surveillance tool.
So how did the coroners get trained on this? Was there some training offered for them?
No, it's really just business as usual for most of the coroners. The coroners are already using the NMS laboratories. It's just us accessing it from behind the lines. So the coroners will essentially not be bothered by us asking for records, right?
Okay.
So we're able to access that, kind of let them, sign the death certificates and get that whole ball rolling, while we are able to abstract the same information and use what we need to disseminate that data.
Is that data sent to you electronically? Is that how that's entered? And
It's real time. So once it's finalized, it pops up in my database, and we analyze it and send it out. So the hope is, all 92 counties, we can provide things like specific metabolites that are seen, so specific drugs that are being taken, and the drug combinations, which is incredibly important, because we're able to, do further research in maybe the combinations in which that are causing people to die of overdose.
Will this also include age, sex, type of area that they're living in, and also?
Yeah, so we collect that information. In the tox program itself, we're not able to really get that info in that rapid manner. We have just basic demographic as sex, age, the county that they expired in. So afterwards, then, we are able to work that information into a mortality data set. However, that's several months down the road. So we're able to provide that demographic information a little bit later.
What's the turnaround time on a death to you getting the information?
Yeah, so so coroners will test and send in their toxicology to NMS within about 2 to 5 days. It takes about 4 to 6 weeks for the toxicology to be finalized. And traditionally, before the implementation of this program, it took 11 months for all the death record and for all of that to get back to me. So now we're able to access that information and get it out to the public in a very, very timely manner.
Great. Well, Jeremy, we're out of time. I appreciate you being here.
Yeah, thanks for having
coming
me.
along. You're listening to The Roadshow. The Roadshow is out.